So lumbar disc is being treated mostly by surgical intervention, lumbar microdiscectomy in typical scenarios. Surely there are some variations to the surgical technique, and sometimes there are some other techniques that we can use, like laser ablation of the disc, which is useful to some cases, but I'm now discussing the most common, most typical scenario when lumbar microdiscectomy is necessary. So what lumbar microdiscectomy is? It is a standard, quite commonly used surgical procedure which is performed under general anesthetics. Patient is lying on his or her belly. Let's imagine we need to take away disc herniation between L4 and L5, which means between 4th and 5th lumbar vertebrae. Let's imagine we need to take disc herniation from the right side. So I will turn the model so you can see better. So that means we need to make a small incision just above the L4 and L5 interspace. So we do an X-ray just before incision to be sure that we are actually above the L4 and 5 interspace. We make an incision, we take the muscles, we retract the muscles from the spine on the affected side, which is right side in this particular case. So then we can identify lumbar laminas of L4 and lumbar lamina of L5. So we know that we need to enter this interspace. Then we do another X-ray just to make sure that we are still on the right track, that we have not deviated from the initial plan. Then this interspace is covered by the ligament, which is called ligamentum flavum or just flavum. It's some kind of yellowish color. We take this ligament out, and usually we are almost immediately able to see the nerve root, especially, and usually nerve root is pressed upwards towards ourselves. So once we mobilize the nerve root, right behind the nerve root there is a disc herniation. So we take the disc herniation away. By doing that, we take some pressure away from the nerve root, and therefore we treat a patient.